All right, so after you've had a hip or knee replacement surgery, you have an increased risk of developing a blood clot. And so there's several things that we're going to use to reduce that risk of a blood clot after surgery. We use what we call mechanical prophylaxis or prevention. So we're going to have some lovely white TED hose, knee-high hospital socks that we're going to have on you after surgery. You'll need to wear these for 6 weeks after you go home from the hospital. After 6 weeks, the risk for a blood clot greatly decreases, and so the need for this is not going to be present after that. In addition to those TED hose, we're going to have some SCD sleeves or sequential compression sleeves. And so these are going to wrap around your extremity. There's a pump on the foot of your bed that's going to plug in, and it has 3 little air chambers that are going to inflate. And those just massage your legs and help promote good blood flow after surgery when you're maybe not up walking around to a great deal just yet. Most patients are not going to need these once they go home. You're just going to have these while you're in the hospital. The best thing you can do to prevent a blood clot after a hip or knee replacement is going to be ambulation. So we're going to get you up and walking right after surgery. We'll talk more about therapy coming up, but our goal is to have all of our hip and knee replacement patients up with therapy walking within an hour of getting out of recovery and coming to the floor. So once you go home, don't go home and plant yourself on a couch and ring a bell and have things delivered. Okay, we want you to walk into the bathroom, walk into the kitchen, walk into the dining room table for meals. Getting up and moving is key for blood clot prevention after surgery. Your surgeon's also going to use some medicines to help thin your blood after surgery. Typically, patients are either going to be on Lovenox, which is an injectable medicine, or aspirin right after surgery, and then our surgeons will send you home with just an aspirin, either once or twice a day, depending on surgeon preference. So your surgeon can discuss more of those details about your particular case after surgery.